Hi friends, welcome back to my channel Mokambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam, also ESIC, DSSSB, AIIMS NORCET, Insurance Medical Service exam, Kerala PSC, and JPHN exam. We can see the questions. Today's question: anti-tubercular drug causing optic neuritis is options: option A rifampicin, option B isoniazid, option C ethambutol, option D pyrazinamide. Here the correct answer is option C, ethambutol, the anti-tubercular drug ethambutol, which cause red-green color blindness or optic neuritis. The main other side effect of this ethambutol include hypersensitivity reaction, dizziness, mental confusion, dermatitis, optic neuritis, peripheral neuritis, also thrombocytopenia, then anaphylactic reactions. Mainly this ethambutol is contraindicated in children's below 13 years of age. Okay. The next question. Tensilon test is used to diagnose options: option A Parkinson's disease, option B myasthenia gravis, option C multiple myeloma, option D Graves' disease. Tensilon test is used to diagnose myasthenia gravis. Option B is the correct answer. And the next question. In newborn, the artery used for palpation of the pulse in cardiac arrest assessment. Options: option A carotid artery, option B radial artery, option C brachial artery, option D femoral artery. Question: in newborn, which artery is used for palpation of pulse in cardiac arrest? Okay, and the correct answer it is brachial artery. Option C is the correct answer. The preferred pulse site for cardiac arrest assessment for adults, it is carotid artery. For children, it is carotid or femoral artery, mostly using carotid artery. And for newborn and infants, it is brachial artery. Here our question: for newborn, it is brachial artery. And the next question, the client has a new prescription for metoclopramide. It's Reglan. On review of the chart, the nurse identifies that this medication can be safely administered with which condition? Options: option A intestinal obstruction, option B diverticulitis with perforation, option C vomiting after cancer chemotherapy, option D all of this. Metoclopramide is an example of gastrointestinal stimulant and antiemetic. And this medicine is contraindicated with gastrointestinal obstruction, hemorrhage or perforation due to its gastrointestinal stimulant activity. So here the correct answer will come option C, vomiting after chemotherapy, because it is contraindicated in gastrointestinal obstruction and perforation, and also it is contraindicated in hemorrhage. Okay, so the correct answer will come vomiting after cancer chemotherapy. It is also used for the treatment of vomiting after surgery, and also after radiation therapy also it is using. And the next question, a client with a chest injury has suffered failed chest. A nurse assesses the client for which most distinctive sign of failed chest? Options: option A cyanosis, option B hypotension, option C paradoxical chest movements, option D dyspnea, especially on exhalation. Here the question is, a client with chest injury has suffered failed chest. Failed chest means it occurs from any blunt chest trauma associated with accident. Here a nurse assessing this failed chest patient, and most distinctive and most appropriate characteristic sign of failed chest is paradoxical chest movement. Okay, the nurse can assess paradoxical chest movement for this failed chest patient. Paradoxical chest movement or paradoxical respiration means inward movement of segment of thorax during inspiration with same outward movement during expiration. That is known as paradoxical chest movement. This we can see in failed chest patient. And the next question, lifespan of mosquito ranges from options. Option A between 7 to 14 days. Option B between 10 to 21 days. Option C between 8 to 34 days. And option D above 34 days. And the correct answer is option C between 8 to 34 days. Normal lifespan of mosquito varies from 8 to 34 days. And the next question, creatine is a metabolic waste product excreted in urine and derived from options. Option A liver, option B muscles, option C bone, option D skin. Creatinine is a breakdown product of creatine phosphate in the muscles. So here correct answer will come option B muscles. And this is filtered from the blood by kidneys, and small amount of creatine also secreted from the kidney. Mainly the product, metabolic waste product excreted in urine and which derived from or formed from muscles. Option B is the correct answer. And the next question, a ratio of sodium is to glucose in WHO reduced osmolarity in ORS is options. Option A 1:1, option B 1:2, option C 1:3 and option D 1:4. Question is, the osmolarity of sodium is to glucose in ORS. It is 1:1. The ORS contain electrolytes sodium, potassium, chloride, citrate and dextrose. Dextrose is glucose. Here our question, sodium is to glucose. The osmolarity of sodium is 75 millimole per liter and glucose also 75 millimole per liter. So 75 same ratio, it is 1:1. And the potassium is 20 millimole, chloride 65, citrate 10. And the next question, a nurse is planning activities for a client who has bipolar disorder with aggressive social behavior. Which of the following activities would be most appropriate for this client? Options, option A chess, option B writing, option C ping pong, option D basketball. Here our question, a nurse is planning activities for a client with bipolar disorder and aggressive social behavior. It is patient is having aggressive social behavior. So in that patient, which activity is most appropriate? Among this option, which is most appropriate? In this patient, we can provide solitary activities, that is individual activities with short attention span. For example, we can provide a writing or a walking with staff, and also finger painting we can give. Like that, short attention span activities we can provide to the patient. Here option B writing is there, so that is the correct answer. Remaining chess, ping pong, basketball, all are competitive game. This competitive game should be avoided because they can stimulate aggression and increase psychomotor activity. So competitive games or competitive activities should be avoided for this aggressive behavior patient. And the next question, which drug is responsible for red man syndrome? Options, option A vancomycin, option B chloramphenicol, option C linezolid, option D all of this. And the correct answer is option A vancomycin. Redman syndrome is an adverse anaphylactic reaction of vancomycin which is characterized by pruritus, flushing and erythema of the head and upper body. And the next question, which test is used to identifying the presence of occult blood in stool? Options, option A Fauch's test, option B Guyac test, option C Benzidine test, option D orthotolidine test. Test used to identifying the presence of occult blood in the stool is Guyac test. Option B is the correct answer. And the next question, Smith test is used to detect options, option A bile pigment, option B acetone, option C bile salt, option D albumin. Smith test is used to detect bile pigment. Option A is the correct answer. And the next question, development of clot in the vein is called options, option A thrombosis, option B aneurysm, option C atherosclerosis, option D ischemia. And the correct answer is option A thrombosis, development of clot in the veins. So here we discussed important and previous year question. Surely these questions will helpful for your exam preparation.